Diabetes, along with its related diseases, is one of the world's most famous health problems. In recent years, there has been an increase in the incidence of diabetes cases. It is a chronic disease caused by either a lack of insulin production in the body or an inability to respond to insulin. When we eat food and it enters our bloodstream, glucose is carried through the blood to cells in our bodies. Insulin can open up channels called glucose transporters and allow glucose to enter cells inside them to be used as energy or stored as glycogen, stored carbohydrate. When there isn't enough insulin or someone's body doesn't respond normally to insulin, this causes a disruption in blood glucose levels that can cause a range of health consequences such as heart disease and stroke. Diabetes is a chronic metabolic disorder affecting how the body metabolizes sugar. Diabetes can lead to heart and kidney diseases, blindness, and other serious health complications. Glycemic control is achieved by balancing the intake of food and glucose with insulin or oral medicines. One of the most important aspects of managing diabetes is diet. It determines how much glucose will be in your bloodstream to control diabetes at all times throughout the day. There are three main factors that need to be managed and regulated in order for a diabetic to maintain their glycemic level: food intake, exercise, and medical treatment. Diabetes is a chronic metabolic disorder that is characterized by high blood sugar level, hyperglycemia. Type 1 diabetes. This type of diabetes develops when the person's pancreas stops producing insulin. Type 2 diabetes. This type of diabetes is usually caused by an inappropriate insulin resistance, or when the body cannot produce enough insulin to control blood sugar levels. It can be managed with various lifestyle modifications, such as regular exercise and a diet focused on healthy foods such as fiber-rich vegetables, fruits, whole grains, and low-fat dairy products. Many people think that it is just a disease that needs to be controlled, but it actually has many symptoms in common with other diseases. Some of these are: increased thirst, increased hunger. Nowadays, more than 29 million people in the United States are living with diabetes. It is a chronic disease that can cause long-term health complications if not managed properly. The condition is characterized by high blood sugar levels and a relative lack of insulin to convert the sugar into energy. People with diabetes need to make sure they have a healthy diet and they exercise regularly to be able to manage the disease. Knowing the symptoms and recognizing them early is critical in diagnosing if you have this condition or not. Knowing what diabetes is, what it does, and how to manage it will help you take better care of your body and prevent complications down the line. Diabetes is a chronic condition that affects the body, but can be managed with self-care. People with diabetes have too much glucose in their blood. To manage the disorder, they need to maintain a healthy lifestyle, which includes eating well and getting enough exercise. Symptoms of diabetes include increased thirst and frequent urination, extreme hunger and weight loss, blurred vision or rapid changes in vision.